Hello and welcome. You are watching Don Bosco Media Network. This is Deepika Lingdor bringing to you the news and events from Meghalaya. Let us first have a look at the headlines for today. Nongse area in Upper Shillong declared as containment zone. Young people with no electronic gadgets unable to register for COVID vaccination. West Chantya Hills District Magistrate ordered closure of Meghalaya Cooperative Apex Bank Limited at Jawai. And nurses appreciated for their dedicated service to provide healthcare. And now the news in detail. In a review meeting on the COVID-19 situation, which was held today, few decisions were made in view of the increasing trend of active cases and based on the report received from districts. The state government has decided to extend the lockdown in East Khasi Hills till the 24th of May 2021.
Government has decided to again extend the lockdown period, which is supposed to be ended on the 17th of this month at 5 a.m. morning, will be extended again for another 1 week, meaning lockdown will be extended up to 24th May 21, 5 a.m. in the morning. These decisions were taken on the basis of the detailed report received from the entire state. Therefore, the government has no option but to extend the lockdown for the safety of our citizens in the state.
Speaking to the media fraternity, Deputy Chief Minister informed that availability of oxygen throughout the state or the oxygen stocks in the states are manageable.
We discussed about the status of the availability of oxygen throughout the state. I am happy to inform to all the citizens of the state the stock of this particular component is still manageable throughout the state of Meghalaya. Therefore, I would request all the citizens of the state not to be panicking as far as oxygen supply is concerned.
It was also informed that the installation of 6 units of oxygen generators will be carried out in Civil Hospital Shillong, and these will be made functional by next week. This will cut down the use of oxygen cylinders in the hospital, which will be sent to other parts of the state.
I would also like to inform the citizens of the state that immediately installation of oxygen generator in Shillong Civil Hospital of 6 units will be installed and will also be made functional latest by next week. With the commission of this generator in our civil hospital, once this 6 units is installed, we will be able to cut down the requirement of cylinders, and the surplus cylinders which is supposed to be spent, which is supposed to be utilized in civil hospital, will be distributed across the state.
The Deputy Chief Minister also informed that oxygen generators for Tura, Jowai and Nongpo are to be made available soon. Installations will be done immediately upon reaching the state. Commissioning of oxygen generators to be made functional by June 2021.
Of 3 district headquarters, number 1 for Tura, number 2 for Jowai, and number 3 for Nongpo is now already on the way. Hopefully within a week's time, these generators will reach the state, and the moment these generator reaches the state, we are going to install immediately. We are going to install immediately in these 3 district headquarters, Tura, Jowai and Nongpo. And I would like to also inform that commissioning of these oxygen generators again will be made functional by first part of June 2021.
Cluster or community quarantine centers will be created in every district up to the community level depending on the requirement. All DCs have been communicated for the necessary actions. These centers will cater to positive cases that are asymptomatic and do not need serious medical attention. This will be done to unburden our hospitals, healthcare facilities and our health missionaries.
Or community quarantine centers, that time we call cluster or community quarantine centers. So this time we decided in the review meeting, that cluster or community isolation center will be created in every district. Up to the community level, depending upon the situation, depending upon the requirement, and this decision is now being communicated to all the deputy commissioners for necessary action. These centers will cater those positive cases which is asymptomatic or falls under category A and B. They can be kept, they can be isolated in such created centers as they don't need for medical treatment, be it in the hospital, district or in Shillong.
Nongse area in Upper Shillong has been declared as containment zone for 10 days from 7 p.m. of 13th May till 7 p.m. of 23rd of this month. This decision was taken by the Block Development Officer of Millennium Block along with the traditional authorities of Nongse in the presence of a doctor when they found out that 39 people have been detected positive after the random testing which was conducted in the area a few days ago. Nongse area has been put under containment zone in order to contain the spread of coronavirus. Speaking to the media, the Secretary of COVID Committee Nongse, Short Star Nongse, said the authorities have no other option but to clamp the area under containment zone since many have been infected by the virus. Short Star Nongse also urged the residents of Nongse to cooperate with the authorities to contain the spread of the virus.
Kamaan ada containment zone swa yang mata sipo nakamta ka jingha jangka sinong nokse แต่ครั้งมันยังได้กับจิงพูดสเตจจงนี้ยังจิงฟังโควิดขัดกันได้แต่คุ้มตาอีวิดีโอดักจิงเขียกจงอีหาริงกัดอีด็อกเตอร์จงกาShastri Memorial Dispensary di Larai Lasim yang tak kabur kepala pengkup dak sarkar hai by in contain lenevan khangdam suaya snong nok se ka jongi lamanta sipusni yai te kumta ngiru lamda pene kata ka jiturwa ka jongi video jengi laya lum committee kerti akisnong ringkat kador basnong I rangba snong I secretary snong kumjuru bat I member jangka covid committee te ngilaya sim ya kani karai bangin priang ya kani ka jing khangdam ban kani kami kalong ka jing persngong ba kamdoni kano ka ban nakaliang jongi ban ang bangin persa ya ke ba sarkar katurwa nomor kani kalong nakabanda ka jing bha jong ka snong ka thau ka jongi hibara kawai.
The social organization belonging to Kathma Orangli today expressed concern over the inability of large number of young people who are willing to receive the COVID vaccination as they are unable to register themselves for want of mobile phones and other electronic gadgets. The president of Kathma Orangli, Angela Rangat, said that the state government should look into this aspect as young people belonging to economically weaker section of the society should not be deprived of this facility. She also said the large number of the young people are unable to register themselves to avail the vaccination as the digital system for registration has been crashing most of the time.
Kalong ka ika basngo si banyo sngo baki paralok samna jongi ki bakat pras nam shaneng ki baya kwa banyo kani ketika covid ki persang ki pau kan ta ban register ya ladi hakat ko Kowin app hendrai kimyo but la poi hakat ko app ko collapse no tingi smutu ba kadon ka jinjar mo ban register ya ladi but ni kwa ban dawai ka sort nak sarkar kumne ba haba ki don ki niki paralok ki bakwa kan ketika mde ban penjenjar pada yaki ban yo ban shim kan ketika.
The district magistrate of West Jaintia Hills has ordered closure of Meghalaya Cooperative Apex Bank Limited at Yamusyang and Jawai branch as its staff had been found infected by the coronavirus. The bank will remain closed till the 15th of this month. The district administration has informed that all those people who have come to the bank should quarantine and also closely observe their health for the next coming 10 days. They also asked the public to strictly adhere to the health protocols, including strict adherence of social distancing and wearing of masks. Along with the rest of the world, traditional head, the Raj, Hima ka Dorbar, ki Kli Nong Sanchar ka Buriuh Nyautreb, ka Federation of Khasi States of Meghalaya conveyed their deep appreciation and gratitude to all the nurses of the state and in the world for their dedicated services on the occasion of International Nurses Day yesterday, the 12th of May. This International Nurses Day was observed since 1974 to commemorate the birth anniversary of Florence Nightingale, who established the dedicated nursing women to provide better health care in the world.
Nagaland ka Grand Council of Chiefs of Meghalaya, ka Federation of Khasi States, ka Dorbar, ki Kli Nong Sanchar, ka Rihin Jotrep, ki Kwa ban ai khublai kerpang madasin, ya baro ki nurse, ki basyakri ya ki pajba hakum kani ka por jong ka jingdon kani ka khlam COVID-19 ai khuble yapi ki nas baro karmen pidon haka met ka washat pakhlan bahiyam basem jo piru ban isude ban ai khuble kerpang yapi baro nagani ka jing sakri jopi ya ka jengrio haki betai ba pidon ki nurse ki badan hakini covid centers ki covid ward mo ki turri kani ka thama klem jin chepti de kani ka si kerpang jupi ka baga prathai bro hoy ka rakhe ya ka International Nurses Day ka khat artarik banai mi khat khandai spa nyu pusau ka de ka sika jong ka Florence Nightingale par la seng ya kani ka larai ban rakhe kani ka sngi ka bade ka sika jong ka Florence Nightingale bakan long ka sngi Joko Prathai ko baki rakhi ki puram yakinas.
Well, dear viewers, that is all we have for you today. Until we meet again, thank you for watching.